Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we have a free book for you when you call the program today at 866-870-5752. That's 866-870-5752 right here in the studio. The book is Stem Cell and Platelet Therapy.
Who wrote the foreword?
Suzanne Summers.
Do we love her?
We love her.
I've been working on her for years. She has different things going on, like a lot of people. She's very active. She does a lot of Las Vegas shows, believe it or not, still. And,
good for her.
I've taken care of her, and I love her and her son. I love her whole family, her husband, Alan Hamill, and their kids. They're all nice people. They're all wonderful people. And grandkids come in. I get the whole mishpucha, as they say. So we were talking about chondromalacia patella. Also wanted to give out the phone number to the office. We have people there that answer phones. The number to call in if we didn't catch your issue is 800-300-9300. But we love our callers, so please call in to the studio right now at 866-870-5752. So let me get back to this question on chondromalacia patella, because that was kind of interesting. It's good subject matter.
Okay.
So as I was saying, chondromalacia patella means bad. Mal is bad in Latin, and chondro is cartilage. But that's not really what's going on. What it is the back of the patella has the thickest cartilage of any bone, and the patella is the round bone in front of the knee. And what happens is often it's not sitting properly in its place in the femur, what's called the trochlear groove. It's a little slot that it fits in. When you bend your knee, the patella gets driven deep into that slot. So for you guys who are heavy-duty runners, jumpers, anything like that, the back of the cartilage of the patella often wears down. And the pathognomonic sign, Anita, you know what that word means?
Pathognomonic, the pathology of the area?
Kind of. It means that it's a dead banger for what the problem is.
Oh.
In layman's terms. That means that if you're having aching in your knee when you're sitting in a theater where your knees are cramped up, well, today the theaters are different. They have a lot of room. But back in the day, or sitting in an airplane where you're cramped up and the knees are stuck in one position, that's achiness that happens. And that is pretty typical for chondromalacia patella. It's really what we call now patellofemoral syndrome, the patella and the femur syndrome. And we heal those every day of the week. It's a really common syndrome. And a lot of people have dislocating patellas. Women get that often when they get their periods, when there's a big surge of estrogen, because the ligaments in the knee, as well as everywhere in the body, loosen up with a high estrogen surge. And a lot of people who are soccer players, a lot of these girls, will have these patellar subluxations, and then they end up with patellofemoral syndrome. The surgery, the lateral release, is a terrible thing to do. Don't ever get that done. In my book, I'm not telling you what to do, really. But my wife had one done when she was a young soccer player, and it actually loosened up the patella even more. So we've both had some problems with our dogs hitting our knees, and with her it can just bump the knee and it can dislocate. With me, I had a knee issue when Big Dakota, how old is Dakota? He's 12 and a half.
Already? Wow.
He's a gorgeous, gorgeous husky. At the dog park, he ran full speed and hit me in the side of the knee and dislodged my patella. And I healed that up with, using platelets and stem cells. I tried regular prolotherapy on it a few times, just using the old concentrated dextrose, and it would help a little bit, but then when I would start sprinting again, it would loosen up. And after I did the PRP and then the stem cells, it really tightened up very well. And I'm actually going to go running after the show, Nita, so that says something about my knees. They're doing pretty good. So again, this person says, I have chondromalacia patella and I can share my MRI report with you. Well, I don't really care about your MRI report other than I want to see it to make sure there's nothing weird going on. But I treat based on the examination. When people have a bad case of patellofemoral syndrome, or what is, in the old days called chondromalacia patella, I can usually feel grinding. So if you folks are having knee pain, one of the first things you want to do is put your hand on your knee, on the top of the knee in the front, and straighten it and bend it a bunch of times and see if you hear some grinding. That grinding in medical terms is called crepitus. And sometimes you get a clunk. You'll get one big clunk. All of those things indicate that you have patellofemoral syndrome, which is something that we can usually help you heal using your own platelets or stem cells. Okay, so it's often something different than that that's causing the knee pain. But when I treat the knee, I treat the entire knee, and we go into the joint capsule using an ultrasound. If you don't use an ultrasound, there's a high probability that whatever solution you're putting in there is, whether it be platelet stem cells. A lot of doctors are still doing steroid shots in there with cortisone, which is a really sucky idea in my book because you're ruining the cartilage with that. Look up cartilage and cortisone on Google and you will see that I'm telling you the truth. I don't know why doctors still do it. You get a buzz for a while where you feel great because it's a really strong anti-inflammatory, but then the pain comes back much worse down the road because you're destroying the cartilage and the tendons and the ligaments. So I don't know why doctors do it. It's not a good idea in my book, in my humble opinion. You go to a different doctor, they'll tell you something else. That's fine. You should listen to the doctor that you love. Always find a doctor you love. And, most important with finding a doctor is find the doctor who does the most of what you want. And don't be shy. When you go to see a doctor, say, how many of these procedures have you done today? I just had a friend, a patient of mine actually, who had a hip surgery, hip replacement. And he asked me which doctors he should go see. And I gave him some names. And I said, ask them how many they've done. He went to a guy who did like 6 or 7 hip replacements a day.
Wow.
That's somebody that I'm going to trust more than someone who says, I did 3 last month. You get what I'm saying?
Absolutely.
So I don't care if you're going to an OBGYN, if you're going to a cardiologist, and you have to have a procedure, whatever it is, ask. Don't be shy. Say, how many of these did you do today? I want to know. I want to know how many. And they go, well, I can't tell you exactly. Go to somebody else. That means they don't want to tell you. Be safe. Always quiz your doctor. Always. And I always tell my patients, number one, if you can help it, don't go to doctors. Because the third cause of death in our country is, what's the word, Nita? See if you remember.
Iatrogenic.
Iatrogenic. That's right. It means that you have a bad outcome based on something medical, meaning you've been given the wrong medicine, you've given 2 medications that interact improperly, you've had a surgery that turned out bad, you've gone to a hospital and picked up an illness there from somebody else. There are germs in hospitals, bacteria and viruses, that you can basically only get if you're in a hospital. Things like Pseudomonas. Why? It lives in the hospitals. Don't ask me why. I don't know. But I don't like getting into a hospital. Luckily, a lot of the surgeries now are done in a surgery center, which is a room that is easily cleaned, and you go in and you go out. You get the surgery done, you leave. That's a better idea than sitting in a bed in a hospital where there's a chance of picking up an infection. And I know a lot of my patients know this, and a lot of people listening to the radio know. I had a very rare tumor on my right adrenal gland called a pheochromocytoma. And it's a deadly tumor, so I tried to heal it naturally for 4 years. I didn't get anywhere with it. And then I had an episode where it leaked adrenaline in a very large amount. I felt a squirt of adrenaline in my gut, and I had a headache like a hammer hit me on the head, and I fell to the ground. And at that point, I knew it was time to have it excised, which I did. And when I had it taken out, the surgeon came into the room afterwards when I woke up, and he said, "I want you to leave right now." And I said, I can't move. I'm in so much pain. He goes, "I don't care. I want you out of the hospital. I've never had one infection in my entire career, and you're not going to be the first." And I had it done in San Francisco because this guy had done the most of anybody. He had done, at that time, like 300 or 350 of them, I forget. In L.A., every doctor I'd talked to had done, if they'd done any, had done one or two. So I knew I wasn't going to have it done in L.A. by these guys. So I searched around the world to find the guy who did the most. I had an amazing outcome, and it was very strange when he kicked me out of the hospital to go back to my hotel room in San Francisco. I literally put my head under the covers for 3 days recovering, and then I went to see him, and the first question was, before I left San Francisco to fly back when I was at his office, was, "When can I start doing sports?"
That's you. What did he say?
He said, "I tied that thing up so tight, you can do it now."
Wow.
He said, "You're not going to be able to because of the pain
Yeah.
after the surgery." But he said, "If you could, you can do it now." He said, "There's absolutely no problems at all." And I talked to other doctors about when I could do sports. That's always my question. And the answer is always something like, well, 2 or 3 months. This guy said, "Do it now." And I actually was able to run in the mountains where I live after 1 week. And I was still in a little bit of pain, but I didn't care. I had to get out and exercise. And then I was lifting weights about 10 days after the surgery, because this guy instilled so much confidence in me that I was fine. And that's something I think doctors need to do. They need to instill confidence. I have way too many people who come in who have, let's say, arthritis in the knee or the shoulder, and the doctor says, "Well, you don't need surgery now, but you're going to need it later." And that's nonsense. Absolute nonsense. We can heal these areas in most cases by using your own platelets and stem cells, what we call regenerative medicine. And if you call me up now on the radio, I'm going to send out for free a copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Won't cost you a dime. And the foreword is written by Suzanne Summers. Actually, she wrote a book, her most recent of all of her books. I think, how many books has she written? Like 18?
Oh, gosh, I don't know.
So, a lot of books on natural medicine.
Question.
And she featured me in the last one she did. There's a whole chapter on regenerative medicine. So she knows what's up. She's been around. I'm going to do another question here because I like the title of it. It says, "Toilet Flush."
Oh,
So
I can't wait.
the person says, "I stopped running 4 years ago. Can't tell if it's lower back or hip pain. Cannot fully recover. Aches to reach to flush the toilet. What's the deal?" I like this guy. So the deal is, I don't know. When someone has to stop running and they don't know if it's back pain or their hip or what area it is, I don't really know either until I do the examination. Then I can tell them in about 2 minutes. That's typically all it takes me to tell a person where the pain is coming from. I can't tell from an MRI or an X-ray or CT scan, although I like you to have them, and I do get them for patients because I don't want to miss terrible things that can be there, like cancers. I've had a few people that have had pain not from a musculoskeletal issue, but from lymphoma or cancer or something like that, where the bone is being destroyed. So I do like to get the images. They keep us safe, but they don't tell me generally where the pain is coming from, if it's just a musculoskeletal issue. So when this person says, "Can't tell if it's lower back or hip," I would have to touch those areas where they're showing me the pain is coming from and then figure that out. The fact that it aches to reach to flush the toilet probably means it is the back that is the problem, but maybe not. Maybe not. I've had that myself where my back was sprained, the ligaments, the iliolumbar ligament, and was sprained, which I fixed by injecting it myself. Not actually myself, by a friend of me injecting it. And actually I did inject my low back one time by myself. I don't like to do that. I wasn't able to get to a buddy to do it, and I did reach over and do it. But I used a teeny little needle so I couldn't hurt myself with it. And it actually worked. It was amazing. I forgot about that. It was one time that I woke up with a back sprain after too much activity. And I did inject myself and got great results. But I typically don't inject my neck or my back because we have issues there with the spinal cord and other things. So we have to be careful when we do those kind of injections. All right, so...
phone number?
Sure, why not? Phone number, I'll give you two numbers. One to the studio to talk to me live is 866-870-5752. You can use a fake name if you like. And do you want to call the office now? There's people there at 800-300-9300. I'm going to take this next question. It says, suffering from neck instability. Okay, let's see what this person says. Hi, I'm suffering from neck instability. I go to a chiropractor 3 times a week to get adjusted. Well, what do you think that does to the stability? What do you think, Nita?
I think it wears down the area and is not.
Well, it's going to stretch
idea.
it out.
Yeah.
It's going to stretch it out if it's forced adjustments, which causes what? Neck instability. That's not a negative statement about chiropractors because I go to chiropractors.
So do
One of my favorites is Randy Weinzoff in Santa Monica. I'll give him a little shout. He's helped me quite a few times. And a lot of times you can have just a vertebrae that's kind of out of alignment, and Randy can just go in there and give it a little push, and it's back in, the pain's gone. So this person says, after getting adjusted, my neck stays in place maybe 2 days tops. That's what I'm talking about. And I need to get another adjustment. So that's not a great idea to continually do that. I know years and years ago I used to adjust my own neck many, many times a day, but the pain would come back after a while. So this person says, well, your treatment works so I don't have to go to the chiropractor so many times. How long will the treatment take? Okay. So yes, that's what we do. We tighten up the ligaments, we thicken them up, and typically people don't have to go back to the chiropractors. Sometimes ever. And I get a lot of referrals from chiropractors because they know that what they're doing works for a little bit, but when they're nice guys, they don't want their patients to come in that much. They'd rather get the thing healed, so they send them to me.
We have a call.
We do? I was going to give a shout out to another chiropractor.
Let's talk
Dan
to Joe.
Monaco. I like Dan Monaco in the Valley. And over here by my side, I like Randy Weinzoff. Either of those guys are going to take great care of you. They're both loving chiropractors with great hands. So we're going to Joe in Costa Mesa about the adrenal doctor you went to and rotator. Let's talk about the rotator. Tell me what your question is on the rotator, Joe.
Joe, are you with us? Joe?
Hey, Joe. That's a song.
I know, right? Joe in Costa
Joe,
Mesa.
I can't hear
Where are
you. I'm just going to talk about... You're there?
Yes. Can you hear me?
Yes.
Barely. Why don't you scream at me? You won't hurt my feelings. Come on, we got to hear you.
Okay. I just would like to know the name of the doctor you went to in San Francisco, just to have it for, recommendation down the road in case anybody, loved one needed that help.
Well, let me tell you this. First of all, that adrenal tumor, the pheochromocytoma, is so rare you will never meet one with that. But I'm going to give you his name anyway because I love the guy. His name is Quan, Q-U-A-N, Du, D-U-H.
D-U-H. And I'm sorry, you have an adrenal tumor, and what is it called?
Pheochromocytoma. It's gone. He cut it out.
Yeah.
What about your rotator cuff? We're going to move on to that. That's more important for this show.
Just, if it's an 85% tear according to the MRI, can you just strengthen the area around that and
yes,
heal it?
I don't know if it'll heal it. It'll get you so you're potentially, all this is potentials, I haven't touched it, pain-free and full range of motion. That's what we're looking for here. When people say they want to heal something, that's different to different people. So, and you're saying it's an 85% tear, and I'm saying, are you having pain?
No, I'm pretty good now. I'm down the road about 3 years. I'm just trying to get an overhand serve like I always had. I was one of the top tournament players. So
okay.
I just how do I strengthen that shoulder now, Doc?
I need to examine you to tell you what's going on. Can you lift your arm straight up in the air?
Yes.
Okay, so you've got good range of motion. And
yes.
The weakness, I don't know why you're having weakness if you're not having any pain.
Well, I had a little bit of pain, just kind of like where the bicep inserts into the deltoid.
Okay.
That was the area of pain always after it happened.
Okay.
But,
you mean you have pain after you play tennis?
I have to admit, for the first time in my life, I take one ibuprofen when I play.
Okay, so that tells me, Joe, that you have pain. You wouldn't be taking ibuprofen otherwise.
Well, polymyalgia came along with my situation.
Well, ibuprofen's not going to help polymyalgia, so that's a whole different story to talk about.
It does help the pain.
No, it might help the pain, I know, but that may not even be pain from polymyalgia. It may be from your shoulder. And can I help you? You have to come in if you want me to touch the area, or you have to take me out to dinner. Nita, come on.
Well, I'll take you out to dinner, and I charge for letting you touch my shoulder. How's that?
That's a deal. I like expensive restaurants, though. Anyway, the number, you can call the office now.
Yeah,
800.
I got that 300 number. Yes.
Okay, but not everybody else does. So it's 800-300-9300. And
Correct.
It sounds like your shoulder is in pretty good shape. And you might just need a PRP or stem cell injection to get that pain gone. I don't know. I have to touch it and tell you where it's coming from and see if I can help you. I can't really do that on the radio.
Then we'll go to dinner. Sounds good. Okay. Okay. Thank you so much, Doc. I'll give the office a call.
All right. I'm thinking Mastro's, Nita. What do you think?
Yeah, I think so.
I like that place. Okay, sounds good.
All right. God bless you, Joe. Keep that serve hot.
Thanks, Joe.
My serve was the only shot in tennis that I was good at. I had the fastest serve on the planet. Do you know the story of my brother who had to have a surgery after our tennis game, Nita?
No.
Ever told you? So my brother's 11 years older, and many, many years ago, he lives in Chicago. I live in L.A. We met in Michigan for a family reunion, and we had about, I don't remember how many, 75 of us meet there. We have a giant family. And we both brought our tennis rackets, and we tossed for the serve, and I won. And I had a very wicked slice serve where I could draw people off the center of the court. And I did that on him. And my brother never misses the ball. He will run, he will jump, he's very fast. So it drew him way off the court, and he jumped to get the ball, and he flipped in the air and landed on his shoulder and ended up getting a shoulder surgery.
Oh, no.
I won with one serve, 1 point. Yay!
My God.
All right. We love you all. Thank you so much. If you want to call me, the office number is 800-300-9300. The website where you can email me is www.lastemcells.com. And Nita, what else you got to say
Thank
besides
you,
you love
Thank
Alex
you,
and
Suzette.
Suzette?
And let's listen to Warren Eckstein every Saturday from 11 to 1.
Yeah.
The Pet Show. He's our pal. And thanks for listening.
And God bless you, Nita. You're a great host.
Thank you.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, To take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.